Hi, my name is Hans Aurora, and today I'm going to be demonstrating how to put in a femoral central line. So here we have our patient. Now, the very first thing, since I'm going to be using sharps, is to let everybody else around me know that we're using sharps. This is especially important in a trauma situation. Hey, I'm going to be using sharps. Everybody watch out.
Thanks, I almost got poked.
You're welcome. Now we have our patient. So it's important to assess our landmarks of the patient. So we find their anterior superior iliac spine, their fingers, and with our thumb, the pubic tubercle. And right in that area right there, if we can palpate the inguinal ligament, we can see approximately where we're going to go, where our femoral vessels are going to be. So with my assistant pumping away, mimicking the femoral artery, we're going to assess where exactly the femoral artery is. Right about here, using my fingertips, and we know just medial to that will be the femoral vein, the vessels traveling towards the umbilicus. Now that we know where we're going, we can prep the patient. So using sterile prep techniques, prep the patient, and while that chlorhexidine may be drying, we'll gown ourselves using personal protective equipment, and then we can sterilely drape the patient, making sure we have our area in view. Then we can take some lidocaine with a small needle, and we can make a wheal under the skin to adequately anesthetize the skin, and then also to go a little bit deeper once we've made a wheal to make sure we properly anesthetize the subacute tissue as well. While the anesthesia is working, we're going to make sure that we have all of our equipment. So we have our introducer needle on a syringe. We are going to make sure that we have our guide wire, that we have a scalpel as well, our dilator, and we have our triple lumen catheter with the 3 ports that we've flushed each one. And we've also made sure to close off the 2 shorter ports, and then also the middle port, which goes all the way to the end of the catheter, we've left open for the wire to pass through. We also have our extra flushes, an extra tube, and a way of disposing of our sharps. So again, make sure we have a right area, which we've marked. We take our needle and holding it at a 45-degree angle like a pencil with the bevel pointed in this direction. And we're going to pull back as we insert, looking for a flash of venous blood right there. Now, just to conserve the fluid in the mannequin, we'll inject the blood or fluid back in. And we're going to remove our syringe and take our guide wire and insert our guide wire, and it should go in easily. And we can actually see, because we have a mannequin, we can see the guide wire passing through our vein. Now, making sure to hold the wire, we can free it. And then make sure we hold on to the wire, and we're going to, without letting it move, we're going to remove the needle. And once we have this area free, we can hold the wire down here, carefully remove our needle, and place it in our sharps disposal. Holding onto the wire, we can also take our scalpel, and we're going to make a small nick right at the base of the wire, flush with the skin, to make some space for our dilator. Thank you. So holding on to the wire, we will thread our dilator on. Again, not letting go of the wire. And then with a twisting motion, we will insert our dilator, approximately halfway. Then we will pull our dilator back out. And then we have our catheter. And we can thread our catheter again over the wire. And watching the other end to see the catheter pass through. Now, if the catheter is not passing through, completely so that we can take hold of it, we can pull back on the wire a little bit. As we pull back on the wire, we'll eventually see it pass through this distal port. So we hold the wire, then we can insert our catheter.
Don't push it in.
Now we didn't, this being a mannequin, it's a little more difficult to insert it since we didn't adequately dilate, but we would insert until we felt approximately 5 to 10 centimeters. Once that's done and our catheter is in place, we can remove our wire, pass it off to our assistant, at which point we would take our flushes and we would check each port. Now we would inject, we would pull back a little bit, aspirate blood all the way through the port, and then inject until the port is clear to make sure we don't clot off. And then we can close off our port. We would do this with each of our ports, aspirating till we fill with blood, and then injecting saline to make sure that we fill the ports so we don't clot off, and close our ports afterwards. And then we could take some suture and secure our catheter to the patient. And that's how you introduce a femoral central line.